We are live, sir.
Good evening, everyone. I hope the audio and video is fine. Can you just give us a quick thumbs up to check whether the audio and video is fine? Okay, so it's a real privilege for me to conduct this session for all of you and with the stalwart of postgraduate medical entrance exam. Today, I'm very happy to share the screen. I think this is the first time that I'm sharing the screen together with Dr. Thameem, Dr. Jay, and Dr. Ramya. So before I start, heartiest welcome to Dr. Thameem, Dr. Jay, and Dr. Ramya. And we will be talking about that how the students can use the eGurukul effectively. Those who are preparing for any exam, those who are planning to enhance their knowledge of medical field, specifically related to the most talk about subjects, medicine, surgery, and OBG. So welcome, Dr. Thameem.
Hello everyone. Thank you so much, Rajat, for the warm welcome. Always a pleasure to share the screen with you. And now I have the special privilege of sharing the screen with Dr. Jay and Dr. Ramya also. So it does feel special to be in one of the best teams, and it does feel amazing.
Welcome, Dr. Jay.
Thank you so much, Dr. Rajat. And it's actually my pleasure also. It's such an honor to share a screen with Dr. Thameem, you and Dr. Ramya. So we all in one frame. It itself is amazing experience. So I'm very excited about it.
Yeah, let's hope that it will be a useful session for the students also. I'm very sure that the students are also very excited for the session. Welcome, Dr. Ramya.
Hi, good evening, everyone. Thank you so much, Dr. Rajat sir. And I feel blessed to be sharing the screen with great legendary people like Thameem sir and Jay sir and you, Rajat sir. So yes, definitely it's a feast for all the students also. And yes, definitely I think it will be very useful how effectively they can use our app.
Okay, so without wasting much of our time, let us straight away go. See, there has been a lot of uncertainty in the past about whether the NExT is gonna be there, whether the NEET is gonna be there. But I think now we have at least some clarities. People are still confused, but I just, for the interest of the students, I just want to clarify certain points. That as per the statement by the Honorable Union Health Minister, 2019 batch student will not be writing the NExT exam. So they will be continuing with their final year exam, and for them the PG entrance exam is going to be a post internship exam. It is yet to be seen that what kind of post internship exam that they're going to be writing. There is some unclarity on this particular part, but as far as my experience goes, it is going to be a NEET exam for them. 2000 the current intern, that means 2018 batch, there is no confusion about it. They will be writing the NEET exam, and any post intern will be writing a NEET exam. NEET PG 2024 is gonna be there. All right, so we're gonna go to the subject wise, and the first I would like to ask Dr. Thameem sir, what is your view that how the student should study medicine as a whole, and specifically the students who are targeting the NEET PG 24 exam, how they should use the eGurukul app? Over to you, sir.
Yeah. So I see, as far as the people who are going for the NEET exam now, the system is the same. Means the time tested technique that is there is you have to make your notes. Notes can come from either looking at the videos, or you have got the ready-made notes that are available now. So, and plus obviously whatever you see in the videos, you have to add the points in that. So the first step is to make your own notes. You should have your notes in hand by about the end of October or November. And after that, you should start planning for revisions. So depending on when the exam is, you should plan out your revision in such a way that you are at least able to do 2 revisions, and 3 would be ideal. But if you can do 2 revisions, or at least, and if you can do 3 revisions, that will be just, amazing. So as far as the preparation is concerned, I think I would like to address in 2 groups, 3 groups rather, I can say post-interns, interns, and undergraduates. So maybe I think we can address the post interns at this point. So as far as the post interns are concerned, I think you have now barely enough time to finish all the subjects. So I would say, depending on your know-how of how much time you have, first of all, you have so many options in eGurukul now that you can really utilize whatever your weaknesses are. If you have sufficient time and you have kept sufficient time for medicine, if you have finished the other subjects, then I think you can see the whole section of medicine. But if you have an issue with that, then I think express videos are there, the revision videos are there, and these revision videos are really very well tuned exactly for the exams what is needed. So although they may not be sufficient to get in the first 5,000 ranks, but I think they should comfortably give you a good advantage in any kind of exam that you write, whether it's the INI-CT exam or the NEET exam. So I think first is the videos. You have to decide where your weaknesses are. Even there, I would give my advice: if you want to start with endo, neuro, and cardio. These are the core subjects, and then after that, do the others. So that as you go along, like when you look at nephro, hamat, romat, GIT, these subjects have a lot of overlap with patho and other subjects. So you don't have to. Where the core medicine is there is mainly the endo, neuro, cardio, where you really have to know that's core medicine. So I think once you've done that, then your confidence will go up. So in this, as I said, two options are there. You have revision videos and you have the proper videos. The idea is basically the revision videos are going to be very good revision for you, but the main videos are going to be giving you core conceptual overview of most of the subjects. Apart from these, as the exam comes close, images are now becoming in the norm. So we have the vibe session, and the vibe session is really built in such a way that you get to revise all the subjects at the same time. You also get familiarized with all the images. So I think vibe is an amazing. Just today, I have given the eGurukul TND as well. So the way I have constructed the TND this time is you can each question I'm telling the technique of how you eliminate the options. See, learning knowledge is one aspect of it, but how you eliminate options and how you narrow down to the choice is also something that one has to learn. And I think our eGurukul TND might give you a good overview of how the correct technique of answering questions would be. So I think all in all, we've got a good package available, and I think if you can just use it to your thing, in the sense, if you have done a lot of revisions already, then I would say look at the revision videos. If you are not that confident, then I would say look at the primary videos. So you do have so many options over there. Rajat.
Yeah. So, sir, there is a question from the student, and which is a very, very relevant question, that those who are starting afresh, how they should start. I mean, from which system they should start.
Yeah, so those who are starting fresh, if you're talking about post interns or whether it's undergraduates, I would say always start with endo, cardio, and neuro. As I was telling that these three subjects, particularly endocrine, is a little easy. So it builds up concepts, very good conceptual orientation you get with the endocrine. Then go to the little tougher one, that is cardio, and then neuro. And I think these are core medicine which do not overlap much with basic sciences. So if you can finish these, then nephro, a lot of overlap with their patho, hemat is a lot of overlap with patho. GIT overlaps with surgery, so a lot of other subjects overlap, but I think these three subjects, if one can do, I think they'll have good confidence in answering questions in medicine.
All right, thank you, sir. I'll get back to you once again. Now I will move to the surgery. Dr. Jay, what is your view that how the student should use eGurukul, specifically right now if they are targeting NEET PG 24 exam? That means basically the focus is post interns and interns.
Yeah, this is a very pertinent question. And first of all, before addressing this, I would like to tell the interns and post interns that they have to close their ears to the buzz of next around. They have to not be affected with the next, what is happening around with the next, whether next happen, whether it will not happen. So they should not be bothered about it. What is their goal should be that they have to have this objective in mind, that they have to get out of this phase. Because as it is, we all very well know that next exam, whenever it is going to happen, we are not going to talk about that. We don't know it also. So the basic thing is that they will not be having, this next exam will be 3 days exam, and it will be we don't know what kind of exam it is going to be. It's all mess actually, if I say it in a right term, because all experiments are going to go on. So they have this opportunity to get out of this phase as early as possible and without being bothered about the next exam. So if they close their ears to the next and they're just focused about the studies, then they will be in a right approach to get the right result. Now coming on to addressing how they should go about I'll again divide, as Dr. Thameem has said, that we have to have, different scope for different folks actually. Post-interns, interns, and undergraduates. So we'll first address the post-interns. Now, post-interns, we presume that you are not working anywhere. You are just sitting and preparing for this exam. So you have a time with you and you have a goal with you, and your target should be, I think the NExT should be happening in November. So we don't know, we don't have a clarity about that too, but then in all probabilities, NExT will be happening. So I feel that they should be completing their course by, if they should target NExT. If I am them, I will be targeting NExT. And whatever, we don't know what is the timeline for NEET exam. It can be early January, or it can be any time. We don't know about that timeline. So I think they should target NExT exam. And when they're targeting NExT exam, so that means they should try to finish the course by mid-September or by end of September. At least, not if that, then October mid, at least. So that if they're not able to get a good result or not able to revise the things in NExT, at least they will have good number of months or days with them to prepare for NEET and have a good revision before a NEET exam. So target a NExT exam rather than the NEET exam, and try to finish the course before NExT. You may not be able to get the desired result in NExT, that doesn't matter. But prepare according to take NExT as a cutoff, and you should appear with a goal that you have. You will give the exam with a full throttle and with full commitment, and that can only happen if you finish by at least September or by October mid at the most. So now to finish the subject, now comes, so this should be your timeline. This is what I feel. This is my way of perceiving the things. Now we have decided the timeline. Now we have to target that how we finish all the subjects. See, we all have been saying that the finishing all the subjects is more important than just doing the few subjects and doing them very nicely and then leaving the other subjects. So your target should be finish all the subjects, and you will be able to finish all the subjects depending on the time you have. As I said, it's a different stroke for different folks. If you have a time with you, the ideal way is to see the complete videos. The ideal way is to do the complete videos and do the PYQs and move on to the next subject. But yes, if you don't have a time and you're short of time, crunch of time there, then in that case, we have done a lot of effort in making the content very crisp in a revision or our express videos. So those express videos, we have done a lot of effort, because talking in detail is still easier. Making the content concise and crisp takes an effort from the faculty side. So we have done a lot of effort in that express video, and in that express video, you will get all the details, all the PYQs, all the PYTs there also. And if you do that, you at least will be able to finish the subject if you are falling short of time. If you have a time and you can manage, it is always better, as Dr. Thameem also said, that it is always better to do the subject nicely. Nicely means doing a complete subject with the eGurukul videos and then adding with the questions. So this is how the post-intern should go about. Now, coming on to the interns. Now, interns again have they struggle with two things. They are the the ones who actually are on a very hard shift going on in them, because they are having ward duties going on also, and they are working also at the same time. So there are two types of interns we have, which I can categorize. Those who have ward postings are not very heavy. They don't have to go to the ward posting. Many colleges or hospitals are there where there are relaxed internship is there. But then there are various hospitals where you have to go, and all biometric and face and all kind of attendance is mandatory. So if you have a time with you, you also ideally should be doing a complete. But then, as I said again, that your goal should be completing the subjects, all the subjects. So see around yourself, try to juggle the time and try to make a timetable schedule in such a way that you should be able to finish the subject by, as a Dr. Thameem and I am also saying, that October mid or September end, you should be able to finish all the subjects. So if you have a time and you can do the complete subject, and do the PYQs with that. This is the ideal if you have a time. If you don't have a time, then as I said, express video are the thing for you, and add the PYQs with that and do the grand test, and then you are through with the subject, and you can come on to the revision. And if you, when you're coming on to the revision, if you have some kind of doubt about a concept, you can always go back to the complete video, and for that particular topic you can see that complete video also, that particular topic from a complete video also. And this is how I think they should be aiming at and going about.
Yeah, Dr. Jay, I have a same question from you. What should be the order? I mean, there is no order in the field, but what should be the order in which the student should read the surgery?
Yeah, this question I keep getting from the students also. See, I have structured, those who have attended my classes, they know that my classes go like a story. So it is all connected. So I have, the way I have, kept the videos in the eGurukul app also, they are in that order itself. So I would recommend, I would suggest that they should read that in that order itself, because if they read that in order, the connectivity will be there, the dots will keep getting connected, and they will get a good understanding of the subject. So they should read the subject in a same flow, the way we have narrated it.
Sorry, boss, I have few more questions for you.
Yeah.
Let's say, students, you said that by mid-October or end of the October, they should be able to finish it. So there will be student who will be starting late. There are students who are starting early. There are students who are starting late. Those starting late, as you said, that they can go with the express videos. So, I mean, is there any, if they're completing everything from the express video, still there are certain topics that you want to mention that they should definitely do from the main video also?
See, first of all, since they are short of time, right? They're struggling. They're running against the time. So in that case, express videos are sufficient for in that case, and with a PYQs. Those topics which are the topics which I don't think express video, we have completed the important topics all there, PYTs all there. So I don't think if they have a short of time, then they should be going about. Yes, in those topics, if they have a doubt in understanding the concept in that topic, then I would recommend to go in that particular topic to the main video and check that concept and the detailing in that particular topic. But the topics which are there, these are the topics which are being asked in all these exams. So if you keep doing those topics and keep doing the PYQs and keep doing the grand test, then I think you are through express videos, and this all will cover 75%, 80% of your things easily. So I think that is the way they should go about it.
Okay, all right, thank you. So before I go to Dr. Ramya, I just want to tell that this is a YouTube series where in this session we are covering 3 subjects: medicine, surgery, and OBG, and there are many more sessions waiting for it. There will be the next session in the series where we will be covering opthal, ENT, and pediatrics. In the next session, the second year subject and the first year subject, in one session, the short subjects is gonna be covered. So there is a complete series where we will be covering all these subjects, that how the student should be using this for enhancing their knowledge and as well as to prepare for any competitive exam. Just to inform once again for the student who have joined late, we have got a pretty clarity that the NEET 2019 batch is not going to be writing. Guys, don't worry about 2020 batch. The medicine, surgery, and OBG, how a 2020 batch should read, that is also a part of the question series that I will be asking as a next round of question for the with the esteemed faculties on that. So that is a question. I don't think there is a doubt that FMG screening exam is gonna be there, bache, and in December it is gonna be there because all the exams are happening. INICT exam is gonna be there, so I don't think that remains a challenge now. Okay, so over to Dr. Ramya now. Dr. Ramya, what is your suggestion to the students who are the interns and the post interns who will be writing this year NEET PG 2024 exam? What is your recommendation and how they should utilize eGurukul videos?
So very good evening to all of you students. So Afghan is a very simple subject and it should be made as your very strong subject, and most of the MCQs or questions which we get in Obgyn is clinical based questions. Like, there's a patient. So what is the next step you will do? So I feel, yes, as all our seniors have already, Jai sir and Thameem sir has put forward, you should try to finish entire topics or entire your subject by October. That will be the most ideal. And as already told, if you're not able to finish by October, then yes, definitely express videos will help you out. And after that, TND is very good for your interns and post interns. So, because the TND is structured in such a way that all the topics are covered in TND, and along with covering in a rapid revision, you also understand, like, how to solve the MCQ, what pattern of MCQs we get, what are the most common questions we get, and when a patient comes, what we have to do, how to eliminate the topic, and what are the possible images which we get. So keep it simple, like try to finish the entire Obgyn one reading, preferably from your notes. Notes are the most important. And while you're preparing your notes, it is very ideal that OBS, you try to finish the OBS maternal adaptation, and then followed by labor, and then medical disorders, followed by when you go to gynec, one topic I'll tell you that you should give a lot of importance, and you listen to it multiple times to make your concept strong. When your concepts are strong, it's very easy to answer clinical questions. So to make your concept strong, please go through reproductive physiology topic multiple times. So reproductive physiology, when you understand what happens, that is how it will be very easy for you to answer everything. And gynec, it's very simple, guys. Like the same concept keeps on repeating again and again and again and again. Like reproductive physiology and embryology, if you take up those topics, that is what will come back again into your amenorrhea topic. And that is, amenorrhea means no menstruation. And obviously, whoever are amenorrheic will get infertility. And those infertility effect we are giving with contraception. So if you understand the concepts, these all topics are same. There's nothing new here. The only topic which is little difficult in gynec is oncology. And for oncology, if you have gone through my videos, I think definitely you all know that I've done very nice mnemonics for the staging and all. So oncology part, you should read once again before you go to the exams. So it should be kept very near to your exams, that oncology again you read and you go through the oncology, entire staging and stage-wise management, right? And one more thing is that it's little bad news, but yes, the FIGO has released the new endocrinal cancer FIGO staging. So yes, I'm going to put a video on that, and you have to just go through that new video of endometrial cancer staging also. Another thing which I would like to tell, apart from what sirs have already told, is please divide your day. Till dinner, you're very active and you're pretty doing it well and all. Post dinner, always try to keep in such a way that you're going to solve MCQs. So till dinner, you try to finish the entire topic, whether you're watching the express videos or full subject videos. So try to finish those till dinner. Post dinner, try to keep, PYQs. You can just solve the PYQs of past 5 years in the INECET, as well as your NEET past 5 years question papers you try to solve. So post dinner, always try to keep questions. So it is very important that you have a combination of, you read the entire topics, as well as if you already have made your notes. So if you already have your notes, then just go through the notes, and then you can either if you want to revise it once again quick along with your notes, then start express videos and just go through your notes. That will finish your entire subject if you have already done the subject previously. And then followed by, definitely go through the TND videos, because TND will give you how to approach the questions, right?
Thank you, Dr. Ramya. So I think we have covered most of the questions that are there for the 2024 NEET exam. Now let's talk about the most talkative batch and the talk of the town 2019 batch. Yes, Dr. Jain.
I would like to answer one question. There was a student who was asking. See, there are few students who have already done the eGurukul 3.0, and they keep asking me also about that 4.0 has new things which are there. So there are many updates in the 4.0, and I have done one thing in that I have kept those updates separately. And those who have already completed the videos from 3.0, they don't have to see all the videos all over again. They just have to go through the updates and you are done. So all those updates are there separate in the recent update section in the Gurukul app. So you can easily go through that and you don't have to see all the videos all over again. This I would like to just mention.
Yeah, no, I mean, that's a very, very relevant point, because this is one of the biggest challenge that a lot of student faces. We used to have a challenge, sir. We have read the old edition of the book. Now the new edition has come, what to do? And now the point has changed, sir. We have read from 3.0, now 4.0 has come. What is to be done? So the question remains same, but probably the source has got changed over a period of time. So now let's talk about the 2019 batch who are final year MBBS student, and they have a big shock. I mean, previously they were thinking that there will be no next. Now, then suddenly they got a news that they will have a next exam. They will not have a university exam, and will be replaced by the next exam, which is an MCQ based exam. And now again, they are in a dilemma that now they will have to write a university exam, which is a theory exam, and they have to simultaneously prepare for a PG entrance exam also. So, sir, Dr. Thameem, what is your suggestion to this batch, which is an experimental batch for almost everything? Everything is happening with this particular batch, starting from the COVID to now going with this experiment of the NEET next again. So what's your suggestion to this batch?
I think, Rajat, we discussed this earlier also. I think the best is just to stay calm. I mean, getting excited or panicky about it does not have help in any way. So they just need to continue doing what has been going on all these years. That means just focus on clearing their final year exams right for now. And at the same time, keeping an eye that they have to prepare for a big exam where they're going to be competing around with 2 lakh people. So keeping both in perspective, they should understand that their main goal should be the big competitive exam coming up, and passing their final year obviously also comes along in the path. At this point, I think for final years, the suggestion is ki if they can read just the basic, I mean the base books, in the sense, stick to the book like Davidson. Let's say if you have less time, reading Harrison now I would definitely discourage, because it's a very tough book to read, and unless somebody's read patho in detail and they are really they got distinction in patho, opening Harrison at this point I think would be highly challenging. So I would say just see our videos. I think particularly if you have shortage of time, again the same thing, the revision videos. But I would definitely say, I think for final years now, you have sufficient time. You have to focus only on final year subjects. So now I think would be a good opportunity for you to see all our videos very nicely. It's built in a very conceptual way. It gives a very good orientation of what really is required. And along with that, we do give some clinical overviews where we tell kids this is how the patient is going to present, and this is the things that you need to learn. So all these add together, it'll boost up your thing. Plus, we do touch upon where required the basic sciences as well, some physio part, some patho part, so that you put everything together and you start building up your concepts. These very strong concepts are needed for you to, not just in cracking these exams, but also overall to become better doctors. I would say, like, without medicine, you can't be anything. You can't be an orthopedician, you can't be a gynecologist, you can't be surgeon. You got to know core medicine to do anything. So I think as far as medicine is concerned, I think understand the core concepts. We've nicely covered them in our videos. So if you go through those videos, I think you should do it, because in the internship, you'll have very less time. And post internship, again, the same thing. The pressures will be so much when there's a sword hanging at your neck. It's very difficult to focus. Now that you have time, I think you should utilize it. And at this point, also get in the habit. See, I think one of the biggest problems I've seen is those who are succeeding now, when we call them on the stage for interviews, we realize that one of the big decisions they made was starting to do questions very early in their preparation. So I think by pre-final, final, some people are starting to do grand tests, doing questions. That habituation of gaining knowledge is one aspect of it, but how they apply that knowledge and how they are utilizing it, that sharpness of how you apply your knowledge and answer questions, I think something that you need to learn. It comes with experience, it comes over years. I think it has to be started now. So all these are things you have to constantly apply yourself, and always keep in mind, no matter what, that you have a big exam that you're going to face. You're going to be competing with almost 2 lakh equally prepared doctors, and you need to really be geared up to face that kind of a challenge.
Yeah, yeah, very, very logical and a very, very apt advice, sir. This is what I keep on saying in my class also. I mean, I'm taking a class in Chennai presently, and I told them that there is something called as a knowledge enhancement and there is something called as knowledge testing. The exam is all about applying your knowledge and ability to pick up the answer from the four choices. So, I mean, the person who is able to get that knack, that how to apply the knowledge that you have learned and able to pick up the answer, is that makes you stand apart in comparison to the other people. I mean, a very, very relevant point that you have mentioned. Dr. Jay, what is your recommendation for the 2019 batch, that how should they should handle this surgery as a subject?
See, one thing the good has happened, that they actually got a clarity that they are not going to have, they're not, this is not going to be a next. So now they know what is there going to happen. So they should focus on the final year subjects. And in this time, when they're doing a final year subject, because clinical subjects are there in the final year they have, so they should, I would recommend them to do it from the main videos. They should see all those main videos. And preferably, I would always say that, I always say this too, that they should make their own notes if possible, because making your own notes is giving you, you're writing it also and you're listening also, you're actually doing two things at the same time. So you're actually revising also at the same time, and you're writing in your own language and your words. So that adds to the advantage to you. So I think they should see the main videos. And as you rightly said, knowing something is one aspect and applying that is another aspect. So they should also simultaneously start doing the MCQs there. And in these videos, which the complete videos we have, that we have all the detailed discussion on surgery there. So they should not be worried about the university exam as far as my subject goes. And they can easily manage with the university exam also, and they can easily take care of the MCQ exam too, because there is a theoretical part and the clinical part both incorporated in the videos. So they will have a good insight, but then they have to find time to do those videos. And even if they do the videos for say 3 hours in a day, they will be able to finish my videos in a span of 25 days if they're continuously doing that. So that way it's not a big bargain. So they'll be able to finish, and then they'll get a good clarity of the concept, and then the surgeries part of them will be taken care of, and they can easily manage any kind of exam with those concepts. So I think they should stick on to the main videos from my perspective.
Sir, can I say that if they are doing your videos completely at this stage and when they are short of time, they need not to worry too much about picking up a textbook?
No, the textbook at this time, I don't recommend them, because we are in the middle of the year, right? So at this time, textbook is always a good thing. Reading textbook is always a good way of, going about in anything. But then at this time, you don't need to be looking at the book. The videos which are there, I have done a lot of effort to assimilate all the various books, latest update and everything there. So it is all there. So you don't need to bother at all about that aspect. So they can totally rely on that. Not
They can take care of their broadly theory exam also
yes,
for
yes,
this. Okay.
yes, yes.
Uh, Dr. Rami, any special advice that you want to add upon which Dr. Thameem and Dr. Jay has not mentioned for 2019 batch?
So I think one thing what you have to do is like apart from seeing our videos, as you have an opportunity to go into your clinics. So when you go to clinics, you use the videos what we have taught. Like if I have taught you placenta previa, and you got an opportunity to see a patient with placenta previa, go there, make an effort, and see. You will see everything whatever I've taught live in a patient. And when you see a patient and whatever we have taught, that just sits deep into you. So don't take clinics, like it's not just about going reading and all. Take whenever you get an opportunity, go to your clinics, see those patients. So when you see those patients, whatever we are teaching registers very deep. And yes, 100% whatever we have taught, that will be more than enough for you to give your theory exam as well. So if you properly do it, yes, you will come out with very good marks in your theory exams as well. So just try to keep it crisp and try to utilize the videos.
Yes, thank you. Sir, Dr. Thameem, last question for you. What about third year MBBS students, that means 2020 batch, they still haven't got a clarity that whether they will be writing a NEET exam or a NExT exam. So that means there is a chance that they might be writing the next exam, which is same as a final year exam for them. So basically, they will be having a 1 year less. They will not be having an internship for them. So, what is your suggestion to them and their pattern? There will be a big, like lengthy medicine of 120 questions. So, what is your recommendation to them? 2020 batch was in third year MBBS at this stage.
So I think the pre-final, I think, is the best year to, really get the orientation and start preparing, because that gives them more freedom. Only 3 subjects that they have at that point. So the idea is, first of all, the subjects that are there, you should get out of the first. Means the ENT opthal is there, and anyway, they are going to have high impact in the next exam as well as for the for the UG exam. So even if the next exam happens, I think ENT opthal now 60 marks. That's going to be putting a lot of importance to it. So I would say first is focus on ENT opthal, finish that, and then PSM. The subjects that are there, unless they are finished, you will not have that kind of confidence and freedom to start preparing for the other subjects. So I think first is focus on them, try to get them out. And even if you are able to finish the ENT opthal, because they are short subjects, they should not take much time. The painful subject in that is obviously PSM. But I think with effort, they can definitely divide their day into 2 parts, and one finish off these current subjects. But at the same time, start preparing for some of the final year subjects. Now, the final year subjects, if people start early, they'll have a lot of time on their hand, in the sense, because once they are in the, like how we are talking about the 2019 batch, they are really in such a tight position now for them to finish medicine, surgery, OBG, on all the subjects in the final year. It's really is squeezing in, and they might have to be, under constant pressure. But if they start in their pre-final, I think that will give them a big advantage. At the same time, the advantage of pre-final is that whenever required, wherever important, you need to go back to the basic sciences. Remember, whoever we met who are really done very well in their studies, it's basically because how good they are in basic sciences. So if you can, generally when you are in your pre-final, you do have that kind of time to, refer anatomy, let's say brachial plexus, and then look at the trauma part of brachial plexus, or look at the cardiac anatomy, and then see congenital heart disease. Why is there transposition of great arteries, and why is that happening? What's the embryology behind it? So I think that's the time. To some extent, we have covered our basic sciences also in our thing. But I think the work that Dr. Ashwini has done, or Dr. Ashish Physio, I mean, the amount of beautiful videos that basic sciences have been made, I think if they refer some of those videos also, where required with medicine, with clinical subjects, I think they'll find it really very beneficial. Rajat?
Yeah, I mean, thank you very much, sir. Specifically mentioning about that how they can integrate the subject. Dr. Jay, over to you. What is your advice to third year MBBS students at this stage for surgery?
Yeah, I'll also go with Dr. Thameem there, but they have to understand, see, there is no clarity on whether they'll have a NExT or they're going to give a NEET exam. But then we are seeing here, the pattern of exam is changing. So all the things are getting clinical, and the subjects which are the basic sciences subject, they're not going to get redundant. Please take this off your mind that when the NExT happen, the basic science subjects are going to become redundant there. Then there will be only clinical subjects. It's just can't happen, because all the subjects are important, and they have an importance in understanding the clinical subjects also. And the kind of the videos, the kind of faculties we have, the set of faculty we have in the basic sciences, that we all are conceptual. We talk in concept-based manner. We are not those of mnemonics type faculty. So we are all conceptual. So all those videos will help you, and you have time. And since you have time, you should invest that time in a best possible manner, because whatever way the exam is going to be, if you have learned something conceptually, be it a NEET exam or be it a NExT exam, it is not going to change anything, because you have understood the subject. It's just a way of asking a question is going to change. So try to read the things in detail. We have our videos. If I ask you talk about the surgery, you should be seeing the videos completely. You should, there's a theoretical aspect also, there's a clinical part also in that. You should go to the ward posting and see all those things live on the patient, that when you're doing that particular topic, and see in the ward posting also. So you'll register things there too. And everything is in sync with the CTME pattern also there in our video. So just do that and try make your own notes. And if you want to enhance more knowledge, because you have a time, if you want to, because this is a time you should have everything in place. All the notes should be prepared by you yourself, and everything which should be incorporated extra, which you want to incorporate, because there is no end to enhancing knowledge. And this is the time when you should be enhancing knowledge, and you can look for the various books also if you want. But then just do with a intent that you have to have a detailed understanding and a conceptual understanding of the subject, because whatever way the exam is going to happen, if you have a concept based understanding, you will not have ever any problem in going through that exam. So go through in a detailed manner, and do it in a detailed manner with add that too with a application part, because learning, as we have been saying, that learning is one aspect and applying that is another aspect. So you have to also develop a knack of answering questions. So simultaneously with our Gurukul, the question bank is now so revamped and it's so all clinical that you'll start enjoying doing also. So you'll make a custom module, do the questions, and you'll find yourself whether how well you are performing, whether you are understanding what you have learned in the text and able to apply in the question or not. So keep doing it, and there is no shortcut to the success. You have to do a detailed study, because you are at a time that when you are preparing, you're aiming for something good in future. So you have to start early, and you have an advantage. So do it in.
Yeah. So, I mean, the key message is try to learn the subject. I mean, as a third year MBBS student, irrespective of the pattern of the exam that you should think, try to learn the concept behind it. Try to identify that why the things are happening, because the moment you have learned the subject, the moment you know the subject, I mean, the pattern of the exam becomes irrelevant. I mean, automatically you're gonna do it. And I think that the eGurukul videos is the best bet for it. And the way that you're gonna enjoy, the way that you're gonna learn the subject, I can assure that the students that this is probably the best learning experience that you're gonna get for the subjects. Dr. Ramya, any specific points that you want to mention apart from one that Dr. Thameem and Dr. Jay has mentioned for the third year MBBS students?
I think Thameem sir and Jay sir have covered everything, to be frank. I think that is more than enough. You have to just have as you are having ample of time, so you have to go through the entire videos and make proper concepts. And for OBGYN, like, it's not much integration with other subjects, but yes, you have when you're doing pregnancy and antenatal care specifically. So that is the time where I want you to integrate it with the PSM, because you're anyway in third year. So, you would have, you're reading the maternal and child health care. So when you're doing the maternal and child health care, integrate it with the pregnancy and antenatal care. So try to go this integrated manner. It will be easy for you, and you'll be prepared, whether it is going to be NEET or NExT, you'll be definitely prepared for it.
Yeah. No, thank you, Dr. Ramya. So, see, in a nutshell, that if I just want to summarize, I mean, see, the rule is very, very simple. First, do a knowledge enhancement, read the subject, but please make sure that you are doing a testing also. You are applying your knowledge, and you are identifying that how you are able to test it. Because irrespective of how much have you read, if you do not know how to apply it, and you are able to pick up the answer on the basis of the pattern of the exam, then that becomes irrelevant. Obviously, the more close you are exam, the testing should increase. The more far is the exam, you should focus on getting more and more knowledge enhancement. Obviously, as you are close to the exam and you have not read pretty well during your earlier days, then you will not be able to do much of a knowledge enhancement. But whatever enhancement that you are doing, you have to focus on the testing part of it. Whatever that you are doing, please make sure that it is your ability of the recall that matters in the exam. That do not have too much in your plate that you are unable to read it or unable to revise it properly. You have every solution available for you at eGurukul. If you have time, you can go with the complete videos. If you are short of time, go with the express videos. The revision videos have been planned in a way that the subject has been cut down, but the content, especially the content that is commonly asked in the exam, has been kept accordingly. The new QBank at eGurukul has has come out in a very, very good way. I'm sure that it is going to be very, very helpful for you. Yeah, so iOS has already been launched. I already have an access of the iOS, the beta testing version. And I think if some of the students have already been given access to that. If you haven't got an access, I think you will be getting it in the next few days to come. There are some more features that we are adding to the app, especially to the question bank, and I'm very, very confident that this year specifically will be a great learning experience for all of you with the eGurukul. The content of the eGurukul has always been the best, and every student has praised. Even those students who were not happy with the app in the past, they all have also praised the content, and we have kept the tradition of maintaining the best of the content with all of you. And now the bigger challenges of the tech has also been taken care of, and I'm very, very sure that this year would be a very, very good experience for all of the students who are learning with the eGurukul. Do reach out to me, guys, if you come across any academic problem. I am always available for all the students. I am more than willing to help you out in the best possible way that I could. Thank you very much, Dr. Thameem, Dr. Jay, and Dr. Ramya, for sparing out your time and guiding the students. Do reach out to us. Do put it onto the comment that how we can help you out in the best possible way. We will try our level best that we can support you, we can guide you, we can mentor you in your journey. We know it's a stressful journey, but I'm telling you that the moment you're gonna get a rank in the exam, you will enjoy this. You will look back at this journey, and you will definitely enjoy it. I still remember, I'm sure that the same thing Dr. Thameem, Dr. Jay, Dr. Ramya will say, that the students who meet you after 4 years, 5 years, 10 years, they have this time, they enjoy this particular time that they have spent. Thank you very much for your time, guys, and we'll stop for the day, and I hope the session was of some use to you. Thank you, everyone. Thank you, everyone. Thank you.
Thank you so much.
Thank
Bye-bye,
you,
guys.
everyone. Thank you, guys.
Bye-bye.
Bye.
Bye-bye.
Bye.
Bye.